the hope is that it's more pronounced, and that's, sort of an intermediate or long-term thing.
So
The only way to know though is sort of time will tell, frankly, and there's no good way other than that.
So what will be her schedule with having scans and?
I think we need to do scans every 3 months, before any major decision point. So even if everything goes according to plan, you'll get
then that will
surgery
be
for
forever.
a while. If things go really well, which is within the realm of possibility, if chemo works well to kill the stuff that we don't see, the microscopic stuff, the surgery takes care of us. And occasionally we have people that are out years and still in remissions without the cancer come back from that. Occasionally, I'd still be wanting these scans every, quarterly or every 3 or 4 months at least for at least several years, even in the best case scenario. Eventually, if things are going really well for that period of time, you might start extending things out to like twice a year or something. If we're really doing well, like 5 years out or something, we might go to yearly. But so you could gradually decrease the frequency of those things if things are going well. But in the initial outset, I'm still concerned that it could be a temporary effect. I'm still concerned that, we could go through this and still find a new area at some point that we have to address also. So at the outset, even as we're going through these surgeries to try to move what's left and see how it goes, I think we need to be very vigilant about closely monitoring this every several months to see how long the effects will be.
And so you said it could still be in the blood, right? Because it's floating around in the blood.
Yeah, I think.
I mean, did you see anything else in the scans that shows it's anywhere else, or really, no, it's just in the lungs?
The one thing we can see is the same areas in the lungs that we knew about before starting treatment. And so that's the positive, is that we don't see any further growth of this, any new tumors developing. And that's the positive. So I do think the chemotherapy has had a positive effect. But what I don't know is how long the effect will be. Will it be a temporary effect, and then it's just right back to the same pattern, it was before in 3 or 6 months, which is possible, or is it a more pronounced effect, and we were able to do surgery to remove what's left, and we're several years out and still don't see things developing. I've seen both, ranges of that happen, and
And cutting it out though is going to help, because then it's not spreading what's in there.
Well, I think that it's the
Or-
it's I think it's the best chance we have. Yes, I mean I think it's a really because it's removing anything that's left, and so those may be a source of spread as well too. So it may limit that degree as well. So I think that it's the right move to take an aggressive approach. You're a young woman, a healthy woman that can take that. Unfortunately, this requires 2 surgeries because on both sides of the lung, and it's not like a simple outpatient procedure by any means, but it's still we want to attack this sarcoma as aggressively as we can, and this is the way that we're going to do it. And our enthusiasm for doing multiple operations for this is a little higher now that we've seen at least some period of stability without new tumors developing after the chemotherapy. Before this, when every time we got a new scan there was a new tumor, my enthusiasm for that was not very high, frankly. Unless we were up to this point where we would see that process sort of stop. That's the reason we did it in that order rather than just go and start operating on different areas, because I was not very enthusiastic that was going to a cat was already out of the bag a little bit at that point. I was not very enthusiastic that was going to be able to solve the problem. And so now there's at least a chance, and so I think it is time to go to the next step and try to go at this as aggressively as we can at this point.
So with the chemotherapy that she did, that stopped further growth from what we can tell in the lungs.
Yeah.
So that's great. But moving forward, let's say 6 months from now, she's not had any chemo again, the tumors from the lungs are removed. Are there other places where this could pop up, or the lungs?
Lung is still the most common. Lung is the most common, but it can crop up almost anywhere. And so there are other areas of the body we need to monitor for as well. The areas of the body we can't see, of course, And so when we will do scans, we will be doing more or less full body scans to try to make sure we're monitoring everywhere.
Would that be PET scans or CAT scans?
Yeah, I think in your case the CAT scans have been a little bit better than the PET scans, the better resolution, and they're a little bit more sensitive for the lung itself, which is the highest, probability area that we would need to be monitoring for. So I think that the CAT scans will be a little easier. And also after a surgery in the lungs, the PET scans are a little bit harder to interpret because they tend to be more reactive. They tend to light up in areas where there's surgical healing, even for a while after, months and several years after. So it makes the interpretation of those areas a bit more difficult as well. So probably it'll be CAT scans. I think are a bit more sensitive for this, for your case.
What makes it a stage 4?
Any cancer that's spread from the original site to somewhere else through the bloodstream is considered stage 4 cancer.
Oh, okay.
And so we're going from the soft tissues to the lung, and it makes it stage 4.
Okay.
That's pretty
And the
similar
soft
to
tissue one, was that a stage? Did that have a stage or?
We probably could have put a stage on it. So if we did not have any evidence of spread to the lung at the outset and just found it in the soft tissue, it probably would have been I don't know, depending on the size and other characteristics, it would have been an earlier stage than stage 4. But I think even at the time there was a suspicion that maybe there was a lung involvement. It wasn't sure certain or not. So I think even at the time of diagnosis there was some
Well,
possibility.
yeah, I mean, early on, because,
Or early on at
I
least.
mean, he did the
biopsy
scan,
and
and
stuff.
I had the bronchoscopy
Yeah.
in January,
Yeah, so at least.
and that was inconclusive.
Yeah, it
and
was
then-
inconclusive, but ultimately in retrospect was already stage 4, at least at that point, is what I would say.
Probably, yeah.
And I mean, yes, I mean, the stage is determined by what you know, I guess, at the time, So once you know that it has spread to another area of the body from the original site, unless it's a very close by spread, sometimes it's still stage 3. But if it's any spread anywhere to an organ, like the lung or the liver, anywhere, then the cancer it's considered a stage 4.
I never really knew what that meant. I mean, other than not good.
Yeah, it usually means that the cancer has already spread somewhere else. That's usually what the stage 4 means for most cancer types.
Okay.
So we're looking at a month or so from now, or
I think so. Yeah, we get you back to start talking
What's
about.
the recovery for that like?
Well, I don't know.
I mean, is it outpatient? I mean, is it?
So there are.
I'll stay
there
for
is
a couple
stay in
days.
the hospital for several days
Couple
between the
days,
surgery,
okay.
and then additional somewhat of a recovery, physical therapy, sort of things. Like after that.
Right.
But like I said, usually when they're doing surgery on both sides of the lung, like I said, usually do the second surgery 2 months later. They feel like they're sufficiently recovered from the first one for that.
Right.
So I don't know if that helps give you a ballpark of the expected recovery time. I mean, some people will go through a surgery like this and feel pretty well back to normal after they've recovered for several months, and some people have residual effects even, permanently. Like the part of the lung where they have a little bit less capacity, or some pain from the surgery that can be lingering. So I mean, it's a little bit different for everybody also, but the initial part is, not super long, but several days in the hospital usually, and then some additional recovery afterwards.
Okay.
But again, I sort of urge you to talk that over with the surgical
Right,
team
yeah.
also too, since they tend to be the ones helping you out during that period of time more than me. So we'll get you back to have that discussion and start the planning with Dr. Tolosa. Then we'll give you some transfusion today to help support you through this initial period and help speed the recovery a little bit so that we can make sure we're ready for surgery in the not too distant future.
Okay. All right. Well, that's it.
some good news. I mean, some.
I think overall it's a positive result today, but I still want to be, I still want to every time we review things to make sure we're all, seeing the whole picture, and that I'm not, I'm being thorough with you and not telling you something that is not true, and make sure there's a realism along with it as well.
Yeah.
I don't think it's a hopeless scenario, and I think that this is a positive result, and there is, gives us hope to move forward with this aggressive approach. But I do think I want to be realistic as well, and I don't want to just paint an overly rosy picture for you and tell you that this chemotherapy cured me or something like that. I want to make sure that I'm being straight also. Okay?
I mean, some women who have breast cancer, we have a friend who 6 months of chemo and it's all gone, and so now she's having a double mastectomy.
Yeah.
So it does, I mean, chemo does cure some cancers, right?
It does cure some cancers, yes. Although in her case with the breast cancer, it's probably not cured. It's probably in some other remission, but not cured. That's why they're doing the surgery.
Yeah,
Andy's one.
okay, well, she'll have to be vigilant too.
But you're right, there are some cancers that can be cured by chemotherapy. Even occasionally these rare cancers like sarcomas, occasionally you can see chemo contribute to the cure rate of them as well. But more often than not, chemo is not a cure for these cancers. It usually helps at least stunt them, it helps prevent further spread. Sometimes it's permanent, but often it's temporary. And it's an adjunct to other therapies like surgery and radiation for the reasons I mentioned.
But radiation does more for curing, right? Or no?
It depends on the scenario. I mean, surgery and radiation are both accomplishing the same goal, is that they can help to get rid of one of the areas that the cancer is in. But it only really affects, the tumor that's removed surgically or the area that they point the radiation beam.
Right.
So it doesn't really do anything to address the part that chemotherapy is most to address, which is the further spreading of it. And so if you're at an earlier stage, if it is caught early, when it's small, before it has spread to the lung, then, sometimes they are cured by just removing it. Sometimes it hasn't gone into the system yet and started to build a spread. In your case, I think it was already in the system by the time it was diagnosed. There was already something in the lung that was questionable that ultimately did turn out to be
Right, because it was removed in October, diagnosed beginning of December, and in January they had a scan. They already had it.
Even when it was removed in October, it had already spread.
I'm sure it had, because that's not enough time period for it.
Yeah,
I'm sure it had spread.
If it was caught a year before that, maybe, whatever, I don't know what time period, but it probably was there for some time before it was found, Unfortunately, sometimes this is a cancer that can be difficult to find initially because it's not necessarily one that